How many of you in here would say you feel sick and tired of being sick and tired? Anybody raise your hand? Okay. Now, when you feel unhealthy, that tends to cause some worry, doesn't it? Like, when's the next shoe going to drop? Now, how many of what are the problems that people face? The health problems you're worried about. Anybody here concerned about being overweight and how that may affect them as far as their sugar level? Maybe they're worried about or have type 2 diabetes, adult onset diabetes. Or they're worried about getting high blood pressure or have high blood pressure. Or, which both lead to what? They lead to heart disease, worried about heart disease, which is the leading cause of death in America. And then you're worried, well, if I feel this bad now, could I have cancer, developing cancer, which is rampant in America today. And what about degenerative arthritis? I just talked to one of the gentlemen today, just one of our guests walked in today at the program today, who just got a new shoulder and he's got two new knees, okay? What if we didn't have to go through that? But that's a potential many of you all face. And then what about Alzheimer's? I was in Dallas I'm on a book tour right now. I was in Dallas this week, and a gentleman came up with his wife, and the poor lady is 70 years old, and when visiting with her, if you talk to her, any physician would say, well, she has early Alzheimer's disease, but she's got all the classical features of hypothyroidism and a hormonal decline, sex hormones at 70 and adrenal hormones. And she can't find a doctor. All the doctors want to give her is Alzheimer's pills. And I know where that's going, and they want to put her in a nursing home, and I guarantee you within a year she'll be a dead woman if she doesn't get treated for thyroid. In fact, I called him up last night. He wrote me a 6-page letter and handed it to me. And I read it last night and called him. And I'm going to see some way I can help the poor gal. And I think we can. I think it'd be a great turnaround. But anyway, these are fears that we have. And we want you to overcome your fears so that you can capture your opportunities and maximize your strengths in your. How many of you would like to live an exceptional life? Raise your hand. Okay. Well, that's what I want. But to get there, we've got to help. We've got to get you feeling healthy and well. And health is really like a three-legged stool. Health is both mental and spiritual and physical. Now, I'm not an ordained preacher, but we've got a lot of good preachers in town, and I encourage people to attend church. I'm a Christian, and I believe people ought to go to church and get yourself spiritually fed. You need to be mentally healthy. I think you ought to be listening to reading positive literature. I think you ought to get personal development tapes. There's a great place to get them. Write this down if you don't know about this. I want to encourage you to do this. I read something last night. I was reading, it was said, hearing, if you hear, you forget. If you see, you remember. If you act, you understand. So you all are in a position today to hear, and it's easy to forget something you hear. So I always encourage to write things down, and we're going to do a little writing down because I want you to get these thoughts into your mind. So if we're going to be healthy, if we're going to restore our health, we've got to have some directions, and we've got to understand what causes poor health in life. And in my experience, and we've seen over 30,000 guests at the Hotze Health and Wellness Center, my experience over the last 24 years, and really since I practiced medicine started back in '76, is that the underlying problem that causes a host of health symptoms in midlife and onward, and maybe happens before then, is the inevitable decline of your hormones. Hormones. How many of y'all have heard the term hormone? Raise your hand. Okay? Everybody's heard about it. Who would like to stand up and define it for the crowd? What's a hormone? Well, a hormone is a chemical messenger secreted by specific glands in the body called endocrine glands that instruct our cells what to do. And we're going to talk about 3 specific groups of hormones. There are a lot of different hormones from different areas of the body, but the ones that really impact us and impact the end organs in our cells specifically are our thyroid hormones from the thyroid gland in the neck, our sex hormones, and our adrenal hormones. Those 3 hormones. And so specifically, I want to talk about and visit with you about thyroid hormones.